Why was I told you wanted to speak with me? I'm kind of on my way to an appointment, so
Okay, yeah, that's fine. So I just and I appreciate you taking the time to meet with me. It's we're just I'd just like to take about 5 to 10 minutes to go over your medications and just
okay.
make
My
sure that
doctor
we're
went
on the
over
same
them with
page.
me, but
Yeah, and that's great. I'm glad that you were able to do that. But sometimes when we go over it again, you may have missed some information, and we just want to make sure that you can take everything safely and
okay.
correctly. Okay, is that okay with
Yeah,
you?
that's all right. Yeah.
All right. So first of all, my name is Sarah.
Hi,
I'm a
Sarah.
pharmacy intern.
Mhm.
And okay, so I'd like to start here by just going over some background information to
Okay.
make sure that we have that. So first of all, what is your name?
Chris Adiga,
Okay, and your date of birth?
103161,
Okay, and your address?
76 Cypress Street in Brookline.
Okay, perfect. And then what diagnoses have you been given?
I have like sleep trouble disorders, and I have sugar issues.
Okay, all right, perfect. And then what other medications are you taking?
I'm taking just what I'm here for
Okay,
today.
perfect.
Yeah.
And then what over the counter medications, vitamins, supplements are you taking?
I've been taking recently Allegra D.
Okay,
I have an
for
allergy.
allergies.
Yeah,
Okay, all
but
right,
nothing
great.
else
Yep,
though.
I will make a note of that. So just let's just start with the new medication, the azithromycin.
Okay.
So what did your doctor tell you that this was for?
This is for my sinus infection.
Okay. All right, great. Yeah, and that's exactly right. It's to help treat infections. It's azithromycin. It's 250 milligrams. So this is what it looks like. Have you ever taken this before?
I may have. I'm not really sure.
Okay. Yeah, it's a common
Yeah.
it's common. It's a common medication to help treat infections. So it's
Right.
possible you could have been on
Yeah.
it before. Okay, great. That's exactly right. So, how did your doctor tell you to take it?
He said like I'm supposed to take 2 pills a day or something like
Okay, so it's sort of right. So you're gonna start by taking 2 pills on the first day,
that. Okay.
and then you're gonna take 1 pill a day after that for the next 4 days.
Okay.
So it'll come in a little pack
Okay.
for you. So you'll just take the first 2 of them. You can just pop them
Yeah.
out of the pack,
Okay.
and then you'll have one every
Left
day.
for-
Yep, for the
for
next 4 days. So
Okay.
it's a total of 5 days,
Okay.
and there's 6 of them there.
All right.
And you don't have any refills
Right.
on that. And then just a couple of things that I wanted to mention to you when you're storing the medication, just keep it in a cool, dry place away
Okay.
from moisture and excess light and that kind of thing.
Okay.
And then also, if you were to miss a dose on it, take it as soon as you remember it. But if it's more than halfway to your next dose, so since it's only after the first day, since it's only once a day, so if it's, I would say, mid afternoon or so, don't take a second one. Just wait
Okay.
until your next dose and
Okay.
don't double up or anything
Okay.
like that.
All right.
Okay. And then what did your doctor tell you to expect?
She didn't really mention anything.
Okay, and that's fine. So just a couple of things that you could expect with this medication is you might experience some mild diarrhea or some nausea or stomach pain.
Okay.
And then the other thing you should just watch out for is if you do get, sometimes you can get some severe diarrhea, and if you do, please let your doctor know right
Okay.
away and don't
Yeah.
take it, don't take anything necessarily to stop that until you've spoken to the doctor.
Okay.
And then also just make sure that you finish the course of the medication.
Okay. Yeah. All right.
Okay. All right. So just to make sure that I didn't leave anything out here, how are you going to take the medication?
I'm supposed to start with 2 pills the first day and then take 1 pill for the next 4 days.
Yes. Okay.
Yeah.
That's exactly right. So, okay. And then what other questions did you have for me?
Well, I really don't like taking medicines at all, and my doctor said that I would probably feel better pretty quickly on this medicine. Do I need to keep finishing it if I do?
Yes.
Taking it.
So, yes, you should definitely finish taking it. This is one of these kinds of medications that it works best if you finish the whole course of it. So even if you start to feel better, and that's great, that's what it's supposed to do. It's if you were to stop it early, it's possible that you could start not feeling so good again.
Okay.
So it's important that you finish the
Yeah.
entire 5 days of the medication.
Okay.
And if you do that, then you should be in good shape. And if not, then you obviously can call the doctor again.
Okay.
But is there a particular reason that you don't like to take the medications,
I
or
just don't like, being on medicines, but yeah, okay, I'll take it.
okay,
I'll finish it. Yeah.
okay, perfect. All right, so let's move on to the refill medication. This is the metformin.
Yeah.
So what are you taking this medication for?
This is for my sleep. I think I have a hard time getting to sleep, so I take that sometimes.
Okay, so this is actually to help with your blood sugar for diabetes.
Yeah, that's that one.
So
Okay.
yep, okay. So
Alright.
this is to help with like I said, with your diabetes, to help lower your blood sugar. And it's metformin. It's 500 milligrams. And you have a 30-day course of it here. So this is what the medication is.
Okay.
Here, is this what you've been
Yeah.
taking?
Mhm.
Okay. And how have you been taking it?
I think I'm supposed to take a pill a day or something like that.
Okay. So with this one, yes, you're supposed to take one every day.
Yeah.
Is that you say that you're supposed to take it? Is that
Yeah, this medicine I'm only taking because my daughter orders it for me. But truly, I feel like that if it's my time to go, then that's it. I believe that, the Lord will take care of me. And I don't know if you can understand this, but I really do not want to be dependent on a medication for the rest of my life.
Yeah.
I just don't, I don't see that happening for me.
Yeah, no, and I can respect that, and I do understand that feeling. It can be difficult sometimes to think about it that way. This is one of these medications that like I said, it does help to lower your blood sugar, which could help potentially. It can help control your diabetes so that you can live longer and that you can live a happier life. And by taking it every day, it actually might help. It helps to make the medication work better. And so that's the reason why you should take it every day. So it sounds to me like you're not, that you don't want to take it because you don't like the way that it feels, or
No, not at all. I don't like it because I don't want to be dependent on a
you don't want to be
medication for the
dependent
rest
on
of
it.
my life.
Yeah.
I want to, I don't see like the other one that you get off of, you
Mhm.
take it and it does what it's supposed to do and then you're done with it.
Right.
This one, I don't see, I just feel like I'm just going to be dependent on it and
Yeah.
I don't really like that idea.
And that's not necessarily the case either. This is something that is going to definitely help you right now by taking it every day. And it's something that in the future, it's possible that depending on how your treatment goes and a variety of other factors, that you might potentially be able to come off of the medication eventually.
Oh, that's good.
But it's something that if you're not taking it every day now, that it's not going to happen. It might not necessarily happen the way that you want it to. And diabetes is something that can be very serious. It can cause a lot of other issues if your blood sugar remains too high.
Yeah.
So things like it can cause heart attacks, it can cause strokes, and some pain issues, and a lot of other complications. And so by taking the medication,
I have to leave in about another minute.
okay, that's fine. I'm just going to wrap up here.
Okay, yep.
So by just taking the medication, it can help you to help reduce some of that risk. And like I said, it's possible that you might be able to come off of it eventually. But if it's something that you don't like, we can help set up to give your doctor a call if you'd like, if you have some time.
Yeah.
Or if you don't now, we can make another appointment
Okay.
to do that. Just one other quick question for you. What sort of side effects are you having with the
Not
medication?
having any side
Okay.
effects with it.
Just a few things that you could experience, just so you know, is you could experience a metallic sort of taste in your mouth, or some light diarrhea, or some gas. But other than that, it sounds like you're doing pretty well with it. So. Okay, so did you have any other questions for me?
Well, if I exercise and eat well, I mean, I keep hearing that that can help you get off this
Mhm.
medicine. I mean, is that possibility?
That is definitely a possibility, and if you'd like, I can also help to. That's I'm going to be honest, it's not my area of expertise,
Mm-hmm.
but I can help you set up an appointment to meet with a nutritionist if
I
you'd
think,
like.
yeah, I'd like to do that because I don't want to be on this medicine,
Okay,
like forever.
absolutely. So we can definitely do that. Let's do this right after
So.
we
Okay.
speak here,
All right, that sounds
and
good.
we can and hopefully that will help you
Yeah.
as well.
Okay.
Okay.
Yep.
All right. So if you do come up with any other questions, you can feel free to give us a call. Our number
Okay.
is right on the bottle here for us. All right.
All right.
Well, it
Thank
was
you.
great to meet
Nice
you.
to meet you too.
Thank you.